Hi everybody, my name is Heather Gluyas and today I'm going to be talking to you about teamwork and communication. So why is teamwork and communication important? Well, we know from very good research that ineffective communication and teamwork leads to errors and adverse events for patients. It's actually a major cause of errors and adverse events. So in healthcare, why would we have ineffective communication when health professionals are dedicated to caring and providing the best care they can? Well, there are all sorts of reasons. One of them is complexity of care. The care that patients now require is much more complicated than it was many years ago. There are many more people involved in that care. And the care we provide in healthcare is across 24 hours. And so we have to have communication between each group of people who are looking after the patients. We have lots of different people looking after patients, but we also have lots of different departments. And so a patient can be an ED, they can go to X-ray, they can go back to ED, they can go to pathology, they can go to the ward, they can go to theatre, they can go back to the ward. And all of those transitions of care involve quite in-depth, or should involve quite in-depth communication. But you can see that communication is it can be just like Chinese whispers. And so something can be forgotten or subtly changed in each one of those communications. So it is not really surprising, given the context of our current healthcare system, that we do have a significant problem with teamwork and communication. So what are some of the barriers that lead to poor communication between teams? Well, we can look at it from a human factors perspective. And we do know that when people are busy, have heavy workloads, are distracted or interrupted, there are certain cognitive processes that can occur that can lead to poor communication. Now, one of those is attentional tunnelling, and that is when you actually focus absolutely on what you're doing. Now, it might be that you are using a new technique, or it might be that you're stressed. It's an emergency situation and you're just focusing on what you have to do. But that attentional tunnelling can actually lead to very poor communication. For one thing, you're so focused, you're not actually communicating what's going on. But it also can mean that you're missing the surrounding communication that's going on around you. Now, in the module, there's a very good example of that with the sad case of Elaine Bromley, when during her procedure they were unable to intubate her, and what then happened was the anaesthetists were very, very focused on actually trying to intubate and were missing the cues that were coming in from around them. One, that the patient was actually hypoxic, and two, when the nurses came in and tried to get their attention, show them the tracheostomy tray, tell them that they'd contacted ICU, the doctors were so focused on what they were doing, they completely missed those cues that there was a problem with what they were doing and they needed to look at doing things another way. Other cognitive processes are things like confirmation bias, when we focus on a solution and we ignore any other things that are going on around us or any other communication. We discount those and just focus on what we've decided is the problem. All human beings have slips and lapses in memory, and this particularly happens when we're busy or when we're doing things on automatic pilot or when we've got a heavy workload. And we can have an inaccurate mental model. We can actually not really be understanding what's going on around us. And when all of those things are happening, communication can be very ineffective within the team, and that can certainly lead to a poor outcome for the patient or an error or an adverse event. Other specific healthcare barriers, barriers that are specific to healthcare, are things like hierarchy. Now, that can be hierarchy between different professional groups, say doctors and nurses, or it can be within groups, so it can be senior nurse, junior nurse. And what happens when there's a hierarchy or an authority gradient is that people who are further down the hierarchy can be reluctant to speak up, even when they can see that the situation isn't as it should be. And I've been in those situations when I've been working in healthcare, and I'm sure you have as well. So that can be a really big barrier to good, effective communication. The other thing is in healthcare is that different professional groups actually have different ways of communicating. So in the main, the medical profession tend to be very exact and scientific in their communication, whereas nurses tend to be more narrative, so they tell a story. But what can happen is people can be talking past each other and not really understanding what the other one's saying or getting the message. So there are pervasive barriers in healthcare. There are general barriers that all humans have to good communication. But within the module, we talk about those barriers, we go into those barriers in great depth, and then we go on to talk about strategies. And I'm not going to go through those strategies. I think that's something that you should be doing, you will get from the modules, and you should go through them yourself and work out which strategies you can use as an individual to improve your communication within a team. So good luck. I hope you enjoy the module and you get a lot out of it. Please feel free to contact me or email me if you have any problems with that. So enjoy the module. Good luck with that.